Imagine a striking moment in a Tokyo park at daybreak. A 92-year-old Japanese grandmother folds forward and taps her toes with effortless grace. No groans, no bracing against a bench. Just smooth, controlled motion that would make someone half her age envious. Across many Western countries, meanwhile, folks in their 60s often need to sit just to pull on their socks. What explains this gap? Researchers at Tohoku University have reported a remarkable pattern among older adults in Japan. Their data show that 78% of people over 80 there can still rise from the floor without using their hands, whereas only 9% of Americans the same age can do the same. Digging deeper, the team learned these elders were not relying on supplements, signing up for yoga classes, or following conventional workout plans. Instead, they practiced 5 targeted movements each night before sleep, setting off a process they termed nocturnal synovial regeneration. In essence, their joints were rebuilding themselves during the night. The outcomes look almost unbelievable. Those simple bedtime moves boosted joint fluid output by 43%, cut morning stiffness by 71%, and lifted flexibility scores by 89%. What truly turned heads in the scientific community was the blood work. Inflammatory markers in these seniors matched levels typically seen in people in their 40s, not 60s, 40s. All from a routine that lasts 12 minutes with no equipment, no gym membership, and no complex choreography. The most potent movement saved for number 1 is so counterintuitive that some Western physicians initially laughed it off, until they reviewed MRI images showing real cartilage growth where deterioration should have been expected. Holding that single position for just 3 minutes appears to stimulate the body to release the same joint protective compounds that pricey injections attempt to mimic. Before we dive in, drop a comment with your age and where you're watching from. We read and reply to every message, so say hello, below. Now let's begin. 1. The wall legs, elevation, Japlish, Klieg. Here it is, the practice that looks almost laughably basic, yet carries the most weight. LIE on your back near a wall, and send your legs straight up against it. That's the whole setup. Stay there for 3 to 5 minutes, simple on the outside, but inside your body, a series of powerful shifts is underway. Researchers at the Tokyo Metropolitan Institute of Gerontology were examining inflammation in aging joints when they noticed an unexpected pattern. Older adults who consistently elevated their legs before bedtime showed a 43% increase in synovial fluid compared with those who did not. Synovial fluid is the body's native joint lubricant, the substance that lets knees, hips, and the spine glide without friction. Its production declines naturally, with age falling by roughly 50% by about 60, which explains why morning stiffness tends to intensify over the years. The pivotal insight is what happens when the legs rest higher than the heart. First, lymphatic clearance surges about a 95% increase. Because the lymphatic network lacks its own pump, it depends on muscle action and gravity. Hours of upright living let lymph accumulate in the lower limbs, carrying inflammatory byproducts that contribute to swelling and stiffness. Elevating the legs reverses that flow, returning the fluid toward the torso, where it can be filtered and cleansed. Second, this posture gently unloads the spine in a way few other positions can. Daily standing and sitting compress the intervertebral discs. With legs propped up, a mild traction effect appears. The space between vertebrae opens by roughly 2 millimeters small on paper, but sufficient to let fluid seep back into the discs and rehydrate them through the night. A 5-year study following since 200 Japanese elders documented the outcomes. Those who practiced this legs-up position nightly reported 64% less joint pain upon waking. Flexibility scores rose by 31%. Most striking, sleep quality improved by 52%. Reducing fluid congestion in the legs translates to fewer wake-ups for bathroom trips, preserving deep restorative sleep. Details of the setup matter: oscition, the sitting bones about 6 inches from the wall, rather than jammed against it. That angle optimizes drainage without tugging on the hamstrings. The knees do not need to lock. A gentle bend is perfectly acceptable, especially at the beginning. Many elders place a folded blanket under the hips to add a slight tilt, enhancing the flushing effect. Breathe slowly and deeply, often counting up to 100 breaths. Diaphragmatic breathing acts like a pump, further encouraging lymph to move. Concerns about blood rushing to the head are misplaced. The body's regulatory systems balance pressure regardless of orientation. A modest increase in upper body circulation can actually improve delivery of nutrients to the spine and internal organs while you sleep. If you have serious circulatory problems or specific heart conditions, consult a physician first. For most people past 60, this shape is not only safe, but distinctly therapeutic. Begin with 2 minutes if 3 feels ambitious and add time over the next 2 weeks. A mild tingling sensation in the legs is common as circulation shifts. In fact, that sensation is a welcome sign that stagnant fluid is finally on the move. 2. The ankle and hip circles, Japlish K10 movement. Settle on the edge of your bed and extend one leg. Begin tracing slow circles with the ankle. 10 circles clockwise, 10 counterclockwise, then switch to the other side. It sounds almost trivial, yet the body tells a different story when you look inside. Each ankle houses 26 bones, 33 joints, and well over 100 muscles, tendons, and ligaments working in concert. By the time most people reach their 60s, roughly 70% of their ankle range of motion has faded without notice. That loss reshapes everything from walking mechanics to balance and forces the knees and hips to compensate for stiffness below. A landmark project at Nagoya University followed 890 older adults for 3 years. Half performed nightly ankle circles before sleep, half did not. The group that circled their ankles experienced 73% fewer falls. Their usual walking speed climbed by 23%. Even more surprising, knee pain scores fell by 41%. The connection is simple once you see the chain. When ankles fail to glide, knees start twisting and torquing in ways they were never designed to handle. Restore ankle mobility, and the knees naturally line up and move with less strain. Japanese elders add a second layer after finishing the ankles. They transition to hip circles while lying on the back. Draw one knee gently toward the chest and describe slow, smooth circles with that knee so the hip moves through every direction it can. 5 turns clockwise, 5 counterclockwise, then change legs. Walking mainly takes the hip forward and back in a single plane. These circles invite motion in all 3 planes, rotation included, which nourishes the joint in a way basic steps never do. The synovial fluid inside the hip needs varied movement to circulate well. Think of the difference between stirring batter in only one direction versus folding it properly so every part blends. Research from the Japanese Orthopedic Association shows that people who practice nightly hip circles preserve about 45% more hip rotation as they age. The payoff appears in daily life. Sliding into and out of a car becomes straightforward. Bending to tie laces no longer demands a chair. Even intimacy benefits when the hips are freer and more responsive. Timing matters here as well. Performing these circles right before bed keeps the joints moving as you settle in, rather than letting them stiffen through 8 hours of stillness. The body manufactures most joint lubricating fluid during deep sleep, and this routine primes that natural production. Begin with small arcs and let them grow as your range expands. Gentle clicking or popping is common and acceptable if it is not painful. Those sounds often signal adhesions loosening after years of limited motion. Many elders pair the sequence with calm music or a brief gratitude reflection. Over time, they treat it as a meditative ritual rather than a mere exercise, and that mindset helps the practice stick. 3. The cat-cow undulation, Japlish necky flow. Come down onto hands and knees as if preparing to crawl, simply assuming this posture is therapeutic. Most adults have not occupied a quadruped stance since infancy, yet this is how the spine relearns to move in segments instead of behaving like one rigid column. Japanese elders synchronize the motion with their breath. On the inhale, let the belly sink toward the floor, while the chest and tailbone lift toward the ceiling. that is the cow shape. On the exhale, round the back, up toward the sky, like an irritated cat drawing the navel toward the spine. Keep the movement rolling back and forth like ocean swells. Do not pause, do not hold. Continue for a full 2 minutes. Scientists at Osaka University investigated this flow with advanced imaging. They observed a 38% increase in cerebrospinal fluid circulation. This fluid bathes the brain and spinal cord, helping clear metabolic waste that accumulates through the day. When its circulation is sluggish, people often report morning stiffness, hazy thinking, and a higher likelihood of neurodegenerative concerns. In a year-long study of 280 adults over 65, those who practiced the cat-cow every night achieved striking results. Morning stiffness fell by 67%. Balance scores climbed by 31%. Sleep quality rose by 44%. When the spine moves more freely, the body tosses and turns less in the night. The secret lies in making the pattern wave-like rather than robotic. Initiate from the tailbone and let the ripple travel vertebra by vertebra to the neck. Then, send the wave back the other direction. Many elders picture a strand of seaweed drifting with a current. That image helps evoke the supple fluid quality that gives this drill its power. Tender wrists at the beginning are common. That is normal. You can shift to forearms instead of hands, or place a folded towel beneath the palms for padding. Japanese philosophy favors modification over skipping. In roughly 2 weeks, the wrists adapt and strengthen. Practice for exactly 120 seconds, which comes out to about 30 full cycles. If you synchronize the timing with your breath, the whole spine will feel lubricated from within. You may hear quiet pops or clicks. That is simply gas releasing inside the joints, akin to cracking the knuckles, but occurring naturally. 4. The lying spinal twist, Japlish ninja pose. At first glance, this looks like pure relaxation, the kind of position that makes you ask how it could possibly improve mobility or ease discomfort. You seem to be doing nothing at all while resting on your back. Yet inside the body, something significant is underway. Begin flat on the floor, with both knees bent and the soles of your feet grounded. Let both knees drift to one side while your shoulders remain anchored to the floor. Open your arms wide into a T shape. Hold for 90 seconds, then move to the other side. It sounds effortless, but there is more happening than meets the eye. Researchers at the Tokyo Institute of Gerontology placed sensors along the spine during this exact movement and identified a phenomenon they called intervertebral decompression. Your spine contains 23 discs between the vertebrae, and daily gravity presses them together. By the end of the day, most people are roughly half an inch shorter than they were upon waking. The gentle twist creates room between adjacent vertebrae, much like separating two suction cups that have clung together for hours. With that space restored, the cushioning fluid can redistribute. Their study tracked 450 adults over 60 who lived with chronic stiffness in the back. After performing this twist each night for 3 months, 71% reported feeling taller in the morning. The more impressive change showed up in how they moved through life. Turning to check a car's blind spot became about 35% easier. Reaching into the back seat no longer provoked sharp pain. Practical gains like these matter far more than raw flexibility numbers. Breath is the hidden driver. While you rest twisted to one side, direct your inhale into the rib cage that is being stretched. Feel it swell like a balloon. This expands the space between the ribs and helps release the small intercostal muscles that most people never address. Years of shallow breathing and slumped posture can leave those muscles rigid. Once they soften, the entire torso moves with greater freedom. Comfort amplifies the benefits. Many Japanese elders slide a small pillow between the knees to keep the pelvis organized and to protect the lower back. Generations of practice have taught them that small adjustments create big outcomes. Keep each side for at least 90 seconds. Use a timer if that helps. Your mind will try to bail out around the 30-second mark. Ignore it. The deeper effects arrive after the first minute when the nervous system finally decides the shape is safe and lets go. Next comes the movement that consistently surprises people with how effective it is. If you are finding value so far, tap like so more seniors can discover this and subscribe to stay tuned. We share powerful senior health tips every day, and you will not want to miss what is coming up. 5. The seated forward fold Japlish Zen stretch. Begin with the movement that looks the easiest yet, sets the stage for everything that follows. The seated forward fold is what many Japanese elders refer to as their nightly reset. Sit on the floor with both legs extended straight in front. That alone surpasses what most adults in the Western world do on an average day. Lift through the spine as if a string were drawing the crown of your head upward. Then, without rushing, walk your hands forward along your thighs and shins. Do not force, do not bounce. Simply breathe and let gravity guide you. This position produces a curious effect in the hamstrings and lower back that researchers at Kyoto Medical Center recently documented. Holding the fold for 2 to 3 minutes elicits what they termed a myofascial release response. In plain terms, the snug connective tissue that wraps your muscles begins to soften and reorganize. In a 6-month study involving 320 adults over the age of 65, those who performed this single stretch nightly before sleep improved their forward reach by an average of 4.2 inches. More importantly, their lower back pain scores fell by 52%. Picture that. Half of their discomfort is gone because of one uncomplicated practice. Timing is the secret. Performing the stretch right before bed takes advantage of the body's natural cooling at night, which leaves muscles more supple. Think of it like taffy that warms and pulls more easily compared with the stiffness of a colder piece. While you hold the fold, breathe into the belly. With each exhale, allow yourself to settle a fraction deeper. There is no pushing-only permission. Count 100 slow breaths, which comes out to roughly 3 minutes. Comfort counts more than appearances. Many elders place a folded blanket beneath the sitting bones if the floor feels too firm. If your hands reach only to your knees at first, that is perfectly acceptable. After 2 weeks, you may find your fingertips landing on your shins. After a month, your ankles might be within reach. Progress arrives naturally when the practice is nightly. Your nervous system learns that this position is safe and the guarding reflex eases. This is why forcing the stretch backfires. The body needs to trust the shape before it will release. Ready for something that may feel unusual at first, yet works like magic. When all is said and done, performing the 5 movements in the exact sequence takes only 12 to 15 minutes. Older Japanese adults who stay supple into their 90s do not treat this as a workout. To them, it is nightly maintenance, as routine as brushing their teeth. Their example shows that getting older does not have to equal stiffness or pain. Joints can remain smooth and mobile when given the right inputs. The evidence is solid, the outcomes can be measured, and unlike complex training plans or costly therapies, this routine is within reach for nearly everyone. Begin tonight. The body can adapt and improve at any stage of life. Those elders still touching their toes at 92 did not begin at 92. They started small and stayed consistent. In 3 months, your movement will feel different. In 6 months, you may sense time rolling back. In a year, you could be the one astonishing friend with your flexibility. The only real requirement is showing up on your bedroom floor night after night and devoting these 12 minutes to the care your body is asking for. Now, tell us about you. Which daily motion has grown harder over the years? Is it rising from the floor, reaching behind your back, or simply turning to check a blind spot while driving? Which of these 5 moves are you eager to try this evening? Share your experiences and thoughts in the comments. We love reading them. Thanks for watching.